So in this lecture, we're going to learn about three things. Endobiogeny, we're going to understand the approach to medicinal plants, so we're going to discover the science of endobiogeny course. If you have any questions, feel free to type them in the chat box or in the questions box, and Brigitte will moderate the questions at appropriate stopping points in the presentation and afterwards. Endobiogeny is a whole systems approach to health that's based on physiology and the interconnectivity of all living beings, all the elements within a living being, and how metabolism, physiology, and psychology affect health and illness. The advantages of the approach of endobiogeny are that it respects the whole person and traditional wisdom. It's rooted in contemporary science and finds a place for rationality and rational inquiry, as well as the traditional and empirical approaches and the respect we have for the experiences of communities and the experience of individual practitioners. And then finally, because of these various approaches, endobiogeny recommends both standard medical and traditional healing modalities, as well as lifestyle interventions, mechanical, manual therapy, etc. So let's talk about this concept of metabolism. Essentially speaking, life, biological life, is metabolism. It's the ceaseless transformation of energy and material through two basic actions: catabolism, which is breaking material down and liberating energy, and anabolism, which is building up material and using energy to do that. There's an orderly management of metabolism, and we know this because life is orderly and it evolves and continues in an orderly fashion until a person gets sick. But if there's an orderly basis to the start of life, there has to be some type of manager that manages this orderly transition between catabolism and anabolism in the ceaseless activity of metabolism. And that manager is the endocrine system or the hormonal system. The endocrine system ensures the coherence of life, the order of metabolic activity, and ensures the larger plan of moving from surviving to thriving and achieving our human potential in all levels of our existence. So when we talk about this notion of hormones and metabolism, we can start with this basic concept. There's metabolism, and hormones manage the two branches: catabolic, anabolic, catabolic, anabolic. So we see that in the sequence in time, there is a rationale and an order to how the body manages metabolism. And there are specific families of hormones or hormonal axes, which are predominantly catabolic or anabolic. So this is the beginning of our model. Now, the autonomic nervous system plays an important role. So as a quick reminder, the autonomic nervous system refers to the sympathetic and parasympathetic nervous systems. The ANS, or autonomic nervous system, assists hormones in managing metabolism because they can adjust the intensity, the duration, the sequence of how hormones are working. So we've gone from this dualistic notion to a triadic relationship of parasympathetic activity, alpha sympathetic activity, which is the first branch of the sympathetic nervous system, beta sympathetic, which is the second branch of the sympathetic nervous system. And then we have a return to the parasympathetic nervous system, which represents rest In addition to the role of the autonomic nervous system, there's an important role recognized that is played by the emunctory organs. These are the glands of detoxification and drainage. Because all of the activity of catabolism necessitates the ability to drain away inflammatory proteins, partial proteins, other waste material that have been broken down but not incorporated back into the body. So overall, now we have a system, a model of integrated physiology that includes the neuroendocrine system. Neuro is for the autonomic nervous system. The endocrine is the hormones and the emunctories in order to provide metabolites for metabolism and to prevent autointoxication by removing the waste products of metabolism. So let's make a distinction now and clarify what is metabolism, what is physiology, and what is integrated physiology. As we mentioned earlier, metabolism is the transformation of energy and material. Physiology is the management of all the elements that are required for metabolism. So when we talk about physiology, here we're talking about, say, cardiovascular function, cardiopulmonary function. How do you incorporate oxygen? How do you circulate the oxygen? How do you digest? So digestion, extraction of nutrients, the lymphatic system, all the other elements that allow metabolism to occur and for the removal of waste products are now in this category of physiology. Integrative physiology is the major contribution that endobiogeny brings to the science of clinical medicine, which is understanding the sequence of events that result in illness and perceiving and approaching all the levels of function, cellular, tissue, organ, the global system itself. And we're looking at the integrated physiologic activity within a specific level of organization and across different scales of organization. So, for example, how does the bone, by releasing osteocalcin, affect the brain's perception of metabolic need? That would be a multiscalar function because we're looking at how an organ, the bone, is influencing the global system and regulation of the adaptation response. This integrated physiologic approach with a unique model for every disorder allows us to have a clear understanding of the origin of nearly all disorders and to create a rational selection of medicinal plants and other interventions which go to the root cause of the imbalance. And we'll talk about that a little bit later. So one way of thinking about this multifactorial, multiscale thinking is through this image from a book chapter I published last year on anxiety. And you can see here that endobiogeny is considering the microscopic level, the mesoscopic level of organs and tissues, and the phenomenological considerations, things like social networks, influence of school, religion, culture, geography, weather, etc., food. And for each of these different levels of analysis, there are different factors we consider: genetics, epigenetics, metabolism, biochemistry, nutrition, immunity, hormones, neurotransmitters, personality constructs, family, trauma, society, etc. This is the profundity and the holographic approach that endobiogeny takes. Let's look at it in a dynamic model now and come back to this earlier image of hormones and metabolism. So again, we have this notion of metabolism as the essential function of biological life. And we have these two alternating categories: catabolism, which is breakdown, and anabolism, which is buildup. And it's the endocrine system which manages this. We have the four major lines or hormonal families that have these predominant metabolic actions. And now we're going to introduce the autonomic nervous system to your left. We have parasympathetic, presented in the Greek here, stimulating alpha sympathetic. Alpha sympathetic, which is represented by noradrenaline, is going to stimulate an adaptation response, which leads to the sequential activation of hormones. It's also going to stimulate adrenaline for things like muscular activity, increased respiration, cardiac activity, acceleration of enzymatic function within the cells. And then there's a return to baseline with parasympathetic. And in addition, we have the emunctory glands, which I mentioned. So we see that common to break down by adrenal hormones and thyroid hormones are the liver and the intestines to manage those waste products. But in tandem with adrenal family hormones, we have the kidneys playing a role. And in tandem with thyrotropic hormones, we're going to have the lungs playing a role in exhaling carbon dioxide. And of course, the kidneys are also managing carbon dioxide for acid-base balance as well. And of course, we have an overlay of the mind, which we won't discuss here, but I wanted to acknowledge it as part of our larger approach to the human being. So with this model, we can say that according to the theory of endobiogeny, disorders are fundamentally an imbalance in these various elements of physiology and metabolism. There's always a hormone and a hormonal family which is initiating a response to some type of threat or aggression to the individual to try to compensate for that threat. It could be an infection, it could be a change of seasons and seasonal depression, could be a change of the time of day from night to day and the need to wake up. But this entrains a series of other hormonal responses that are sequential. So if you started here, for example, like you would say with Crohn's disease, then the next response would be here and then here. So there's this notion of which hormonal line would try to address the problem and which ones became involved to also assist. In addition to identifying the hormones that are related to a specific disorder, we're looking at the role of the autonomic nervous system, which branch or which branches are involved, and how has it disrupted the sequence, intensity, timing, etc., of how hormones are managing some threat to our homeodynamic equilibrium. And then finally, there's always a specific individual or combination of emunctories that are also implicated in every disorder. So the only exception I would say to this would be disease model is inborn errors of metabolism, where you have some specific genetic-based disorder. But even then, all of what I mentioned here, the hormones, the nervous system, and the emunctories, are playing a compensatory role for trying to manage whatever the deficient or excessive metabolic activity is related to the genetic error. And of course, traumatic events, traumatic injury, a crush injury, again, is not started by the hormones, but the hormones are going to play a role locally or systemically in dealing with the trauma and trying to repair the injury. So this model is really applicable ultimately to everything. Okay, so this is a really important slide to spend a little bit of time on, because this is going to be the basis of how we talk about medicinal plants and how we understand them. So outside of genetics and our epigenetic activity, there are four sequential pathways in the expression of disease. We have here in the top in orange the risk of disease, which is what we call the pre-critical terrain. These are latent imbalances, imbalances that typically are asymptomatic or very mildly symptomatic. So examples would be pancreatic insufficiency. Maybe a person can tolerate a little bit of dairy, but not a lot. Or they can tolerate dairy and animal protein, but they don't do well with fried animal fat, for example. So there's some insufficiency in pancreatic enzymatic activity. Or it could be something like a hyperparasympathetic state. So once you have this pancreatic insufficiency, you're going to have overactivity of the vagus nerve, initially the branch that just stimulates the pancreas, and then later it can overstimulate other organs as well. But these are all latent imbalances, and there'll be hormonal imbalances which can be present. Then there's some type of aggressor, some type of disrupting or provocative event which the body has to respond to in order to return to its prior homeodynamic equilibrium. The way each individual responds to whatever this provocative event is called the critical terrain, because ultimately it's not the provocative agent that is causing disease, it's the body's response to the provocative agent or the body's response and the provocative agent. But this is at the level of pathophysiology, and this is what we're calling the root cause origin of the disease. Because at this point, there's a specific group of neuroendocrine and emunctory imbalances that are often different than what put you at risk for disease that are now active because they were not able to respond to the challenging event, and they continue to try unsuccessfully to respond to this threatening event. And this is what actually creates the mechanisms at the cellular level, which lead to the effects, which are the symptoms that the patient is reporting or the signs that the practitioner is recognizing during examination. So if we start at the bottom and think about through the history of the use of medicinal plants in human civilization, the majority of the use has been traditional and empirical and oftentimes symptomatic. Now, before, let's say, the 19th century, we didn't really have a fully developed concept of physiology. We had a lot of elements of the concepts of, let's say, circulation of blood, which started to be developed. There were some understandings of the roles of certain organs, but we didn't have a concept of hormones, for example. But, by the time of Claude Bernard and by the late 19th century, we were really developing a concept of physiology. Before then, it's true there were concepts of humors, but these humors were more like conceptual categories. And a lot of the use of plants, and if you look in your Materia Medicas from the Middle Ages, the 18th century, 17th century, even the 19th century, a lot of the actions are describing these symptomatic activities, that something is depurative or it's a febrifuge or it's diuretic. And then by the time, again, by the late 19th century into the 20th and 21st century, as this rational scientific approach and a physiologic and then a biologic approach was able to elucidate specific cellular pathways of how medicinal plants are working, we started to be able to look at a deeper level of action and then the ability, let's say, through chromatography to identify specific active constituents in a plant led to the idea of having a minimum active concentration of something or extracting an active concentration and using it in isolation from the totem of the plant. And so we saw writ large, this interest in identifying medicinal plants based on a rational and biochemical level of mechanistic action. And then from my perspective, as a medical doctor who had no training initially in medicinal plants, except from what I learned from my mother about traditional Iranian folk use of medicinal plants. What was so stunning to me, as someone trained in physiology and critical care physiology, was that Dr. Dorfour and Dr. Lapraz helped elucidate these root cause activities of the medicinal plants by saying, there is a terrain, there's a local terrain, a local environment, there's a global terrain, which is causing a specific disorder to occur at a specific time in a specific organ in a specific person. And all these plants in these various galenical forms that we've been using based on their symptomatic and traditional uses or their rational biochemical activity or components also have this upstream ability to regulate the fundamental neuroendocrine drivers of disease. And what was also significant was that through experimentation, Dr. Durfour, Dr. Lapraz, and the group of doctors working with them in France in the 1970s were able to determine that a surprisingly lower dose of medicinal plants were required to successfully treat disorders. Because once you started combining plants and using them to address these root cause neuroendocrine and emunctory imbalances, they then took care of all of the need to regulate the mechanistic cellular dysfunction, and they already have symptomatic action, ergo, because of their ability to regulate the mechanistic functions. And then when Dr. Durfour developed this functional biomarker analysis system, which we now call GEMMA, which I'll get to shortly, we were able to look at the pre-critical terrain or these latent imbalances that are present, oftentimes asymptomatically, and that introduced a whole new notion of prevention. So, for example, if you have a patient who has spring allergies and you draw their blood, you just draw a simple CBC differential, and you can enter this data into our analytical system. And you can immediately see what the current level, the estimated and modeled level of cortisol is, of histamine, of other elements that are related to the allergic terrain. And if you find that there are imbalances, but the patient has not expressed signs of allergies yet, you have an opportunity to rationally and precisely select the medicinal plants that they specifically need. Maybe they need more antihistaminic plants. Maybe they need more drainage. Maybe they need better support of cortisol production and activity. But with this model, we're now able to introduce several other levels of criteria for the selection of medicinal plants and other interventions. So let's take this idea and apply it to the concept of how would we apply salvia, how would we look at Salvia officinalis or garden or Dalmatian sage. So on the same model, we can say here, well, sage is estrogenic, so it's going to help support disorders that have to do with an absolute or relative insufficiency of estrogens. And we know that it supports the adrenal cortex and the production of adrenal hormones, and it has a thiotropic action. So it helps with these catabolic disorders. And therefore, if you also have a patient who has disorders of insufficient catabolism or too much accumulation of material, like allergies, like arthritis, you can still think about using sage. And we know that it has this nootropic activity because it improves memory and mood through its cholinergic activities and other activities. So you can use it for central nervous system disorders. And on your far left, you see in yellow that it can help regulate parasympathetic activity. Why? Because it improves hepatobiliary function, digestion, and it can help address the aspects of dysbiosis in the intestines, as well as intestinal permeability issues and the pancreas. So we can start to think about plants and overlay their actions onto this model. Here's another example with wild pansy, Viola tricolor. Again, we see here on your left in the corticotropic system, if we wanted to use pansy to treat acne, we can think about these primary activities and effects that it has on congestion, on dysbiosis, on the immune system at the mechanistic level, and in the healing response for scarring acne as a wound healing agent, and to promote more drainage. So we can see, for example, that pansy by itself would be a helpful but not necessarily sufficient treatment for acne because there's also a hormonal component, and that's where you could bring in other plants. So now that we've established this, let's talk about just some very specific examples coming from the corticotropic axis, which would be the hormones related to the adrenal gland. So we're talking specifically here, we're just going to focus on cortisol, the anabolic steroid activity, which we represent here as adrenal cortex. So we can think about how cortisol, when it's high or has a strong effect, has various actions in these different domains of physiologic activity. And when it's low, it has these other actions. And the same thing when there's excessive or insufficient anabolic steroid activity as well. But then we can expand this notion and look at the qualitative relationship. So when the ratio, for example, of in the top line here, of cortisol to adrenal cortex or catabolic to anabolic steroid activity is excessive, absolutely or relatively speaking, we can start to associate it with other types of disorders. So now we have qualitative and quantitative or absolute levels of assessment and association with various conditions and symptoms. Now, how is this going to impact our selection of medicinal plants in endobiogeny? We're going to talk about that briefly in just a moment. So I mentioned this analytical system we have. It's called GEMMA. GEMMA is an acronym for Global Endobiogenic Mathematical Modeling Assessment. And this is our functional biomarker analysis tool. It is available to any qualified healthcare practitioner. Even if you don't take our course, you can start using the system. We will teach the optimal way to use the system in our Science of Endobiogeny course. This modeling tool, GEMMA, uses proprietary algorithms initially developed by Dr. Durfour and then additional ones developed by myself to deeply understand imbalances related to screening, prevention, as a diagnostic aid and as a therapeutic aid in your practice. And there's a wide range of conditions that can be addressed at a much lower cost than quantitative measurements. I'll explain a little bit more in a moment. So since we've been talking about the adrenal gland, let's look at a panel we have in GEMMA called the Adrenal Balance Panel. So here's an example of what you could see on this panel. All you need is a complete blood count, a simple blood count with platelets in order to get these results. And remember here, we're not measuring cortisol or anabolic steroid activity or adrenaline. We're modeling the effective activity at the tissue level. So we're not measuring what's circulating in the blood. We're modeling its effective functional activity after all of the receptor polymorphism, second messenger activities, xenobiotic impacts, all those things which are unmeasurable effectively have been taken into account, what ultimately happened. So we can estimate cortisol activity, the general anabolic restorative activity of adrenal hormones like DHEA or androstenedione. We have this qualitative analysis of the relative ratio of cortisol as a catabolic hormone to these anabolic steroids and the adrenaline gut response. So the GEMMA system will give you a range, provide a value, indicate if it's high in red, low in blue. If it's normal, the box will be uncolored. Then there's a physiologic interpretation to guide you to understand, well, what is the significance of this finding? And in addition to that, for each of these modeling indexes or formulas, there's a series of recommended medicinal plants uh, that are sometimes specified as being, let's say, primary and then drainage plants, and some recommended vitamins, minerals, amino acids, and other interventions depending on specific needs. So what you can see here, my friends, is a very rational method of selecting medicinal plants for that level of root cause imbalance that's directly related to the regulators of the mechanistic and symptomatic effects that are associated with disease. And then there's a discussion which explains what the meaning of the index is. Some of the panels will also go into an explanation of how we constructed the indexes, what's the clinical evidence for selecting the biomarkers that we did, et cetera. So I want to break down and show you just generally the type of algorithmic thinking that we teach in endobogeny and that the GEMMA system automatically applies to assist you in reflecting on the most rational and physiologically relevant way to select medicinal plants. You can always use your intuition. You can always use your empirical experience. This now provides a higher level of confirmation. So, for example, when the cortisol index and cortisol activity, clinically speaking, is high, we can recommend some various medicinal plants, and we can think about their action specifically related to cortisol. When cortisol is low, we have similar reflections. When the anabolic steroid activity is high or low, we have similar reflections as well. And similarly, when qualitatively we think about, well, if the catabolic activity of cortisol is relatively or absolutely greater than the anabolic steroids, all told, there are some additional plants you can think about, and the same thing when the ratio is inverted. So in this way, you can start to construct your own personalized selection of medicinal plants. Again, at another level of reflection, if you're interested in reducing the total number of plants that are used or the total number of products. So in summary, this rational clinical and mathematical approach of endobogeny allows you to create increasingly elegant and simple and streamlined ways of approaching complex disorders. Well, let's come back to this idea of how endobogeny brings a sense of efficiency and economy to your practice. For example, let's just start, let's look at, in the interest of time, just the adrenal fatigue, which is the middle panel in light gray. Of course, you want to ask about the fatigue pattern on your intake, and you want to palpate and look at different signs of adrenal insufficiency, absolute or relative. But if you use an endobiogenic approach, you order a simple blood count, it comes back in 24 hours, and you select the adrenal balance panel, and you get all this information that I showed you earlier. And in less than 24 hours, you can have an assessment of how the adrenal gland is doing, mathematically speaking. In contrast, if you wanted to order salivary adrenal hormones, let's say you want to do a 4-point cortisol salivary measurement and then also measure DHEA, the cortisol to DHEA ratio, androstenedione, maybe you're looking at something like $150, $200, and it would take you 1 to 2 weeks to get those results. So this is just an example of how the endobiogenic approach is efficient and economical. And it's really not a question of this or that. You may find that this initial approach with the adrenal balance panel gave you all the information you needed to start addressing various disorders related to adrenal dysfunction. Maybe, for example, you still want to know what the quantitative output of cortisol is at 8 a.m., at noon, at 4 in the afternoon, and in the evening, because you want to select a specific timing of different interventions. You can still start here because within 24 hours, you'll have your answers. And then once these results come back, you can always modify your treatment. Well, let's conclude this part of our talk by summarizing how endobiogeny benefits your practice. It's an analytical system which takes in everything and allows you to continue practicing what you do, but do it in a deeper and more profound manner. So in other words, endobiogeny is transposable onto your current practice, and it's not imposable. You don't have to stop practicing within your scope of practice or change your practice model necessarily. Endobiogeny brings a sense of coherence, rationality, organization, and insight. There's a flexible use of the history, the exam, and the biomarker analysis, depending on where you live, people's access to medical laboratories, or your time to take a history or do a physical exam. There's enough overlap and confirmation of information that if you do, for example, 2 of these 3, you'll have a very strong level of confidence if you don't have time to do the 3rd one. Endobiogeny expands your knowledge base, and the criteria and the method you use to select medicinal plants offers profound insights and deeper knowledge, and it helps address what has often been times called unsolvable or untreatable conditions. So in summary, before we take questions, endobiogeny combines holism and physiology with the notion of integrative physiology. It evaluates metabolism as the basic function of all living things. It models physiology. This modeling system with functional biomarker analysis reduces the need for costly tests, reduces the time it takes for introducing definitive care with confidence. It saves time in interpretation and treatment selection. And it promotes a patient-centered care with deeper insights and wider range of treatment options to discuss with your patients. Because physiology is such an abstract notion, even for healthcare practitioners, the ability to see the name of an index and a numerical representation of physiologic activity can just bring a greater sense of understanding and appreciation to the patient. Oh, my cortisol is high. Oh, my histamines are high. Now I understand why my allergies are so bad. And conversely, as you start to treat your patient, the patient says, Doc, I'm still symptomatic. And you say, oh, we repeated your allergy panel and your histamines are still high, but they came down by 50%. And your cortisol, which is your natural controller of histamines, has improved by 30%. So I know we're not there yet, but we're definitely getting traction, and these treatments are effective. So there's no need to change them. We just need a little bit more time. Okay, let's stop here and take any questions that we might have. Brigitte, would you like to read those questions?
Currently, no questions came, but I would like to encourage all the attendees to ask questions because it's perfect opportunity to engage with Dr. Hedayat and with our great experts.
Okay. I see there's just some chatting, which is great. Well, if there aren't any questions, I'll continue with the course on endobiogeny, and then we'll get to our panel discussion. Okay. So if you have an interest in holistic medicine, if you have a desire to transform your practice style, if you have training or exposure to other holistic practices such as Ayurveda, homeopathy, or functional medicine, for example, this is the right course for you. This course is for uh, all licensed professionals, and based on the country or the region of the world that you're in, this will include various types of levels of training according to your scope of practice. The Science of Endobiogeny course is a 6-month course. There's one module taught every month. There's 2 to 3 topics per module. We use a flexible style of learning. We actually combine a guided, didactic, and experiential forms of learning. So the guided or self-guided is you'll be assigned this book, The Theory of Endobiogeny, Volume 1, and you will read the chapters ahead of time before we have the lecture. So the purpose of the lecture is not to teach you the material that is in the book, but to summarize and express the essential concepts and allow you to ask questions. You'll also be given a self-assessment quiz, which you can take to make sure you've understood each chapter to the proper level of comprehension before you attend the lecture. The lecture includes both the didactic portion and an open discussion. And then, so for example, the didactic lectures will occur on a Saturday, and on the following day, a Sunday, we'll have an experiential section where we'll talk about 1 or 2 GEMMA panels and present them in the format of a case study so you can apply the didactic and theoretical knowledge you learned earlier in action. And at the end, there's a certification test, which is completely optional, and the ability to have a diploma. So very briefly, you see here, we start June of 2025 this year. And you'll be assigned a specific chapter to read. Every week is our recommended pace. So you would take the week to read it. Each chapter has its own self-assessment test. And then there will be a presentation with the question and answers, followed by the practicum or experiential lab. And then there'll be some time to review what you just learned and to go back to your self-assessment test before you start the next module. So we'll begin with an overview of systems theory, with the autonomic system, the hormonal system in its general sense. And then in the second module, we'll go into deeper understanding of hormones, pineal hormones, corticotropic, thiotropic. So we'll deal with adaptation. And then we'll talk about the anabolic hormones. Then we'll talk about combining hormones and how they work together and how they work with the emunctory organs. We'll talk about the art of the history, the art of the physical in endobiogeny. Well, and then in the 5th module, we'll talk about how we understand the role of biomarkers. What do they mean? How did we build these indexes which model activity like cortisol and histamine without measuring it? And then we'll conclude with the endobiogenic approach to medicinal plants and therapeutics, more broadly speaking, how to bring the panels into your practice, how to combine panels, multiple panels for a single condition, etc. And then you'll have 3 months to take the examination. The pass rate is at 70% or higher, distinctions for 80%, and honors at 90%. If you do wish to take the certification exam, there are 3 pathways available to you. The first is simply to take the exam. The second is to also write an essay. And the third is to write a monograph, to do research and write a monograph, or to do a case study, which can be publishable. And in each case, we will help you, myself and my scientific team at Systems Biology Research Group will assist you in doing the monograph, in preparing the case study, and doing the statistical analysis, so you can also become a contributor to the science of endobotany, should you wish it. So the tuition includes all the course material, the workshops, the case studies. You get the 6-month subscription to GEMMA Explorer, which is our first level of membership, which allows you to do 5 panels per month. You can also upgrade and apply that credit to a higher level of subscription anytime you want. You'll also have access to the course videos for 6 months after the course ends. And you'll have access to the basic level of certification testing and a certificate in the science of endobotany. So we have an early bird special remaining until April 15th, which is just around the corner, my friends. There is reduced tuition and a split payment option. And you can start your 6-month bonus subscription to GEMMA early if you want to get ahead and start to be more familiar with the analytical system before we begin our training in June. So you can go to training.systemsbrg.com and register today, or you can learn more about endobogeny and our program at systemsbrg.com. Or you can go directly to our modeling tool, GEMMA, at gemmabio.com and learn more. Are there any questions at this point before we get cozy and have a conversation?
No, I guess we should just dive into the conversation.
Okay. Okay. Hi, Carol. Jillian, I didn't get a chance to say hello to you. And Paul, whenever you're ready to join us with your camera on. And Colin, thank you. And of course, unmute yourselves. Very good. Will Dr. Lapraz be joining us as a panelist or Gemma?
I can, Gemma may, I invited her. She declined. Maybe she didn't wanna
No
at the
problem.
first to join, but yes, and I can invite Jean-Claude.
Okay. Gemma said it wasn't working.
Oh,
Yeah, she didn't decline. She had trouble. So maybe we can try that again and same thing with Jean-Claude. But otherwise, that's okay. Why don't we get started? Gemma, if you can join us, hop in at any time. Always a pleasure to have you.
there we
And
go.
Jean-Claude, of
All
course.
of us.
Oh, oh, lovely. Hi, Gemma. Looks like a lovely spring day where you're at in the Cotswolds.
Yes, yeah,
Yes.
yeah.
Very good. Very good. Okay, my friends. It's good to be with all of you once again. Let's start. I'm going to ask a question, and whoever wants to can just jump in with a response. Oh, hi, Jean-Claude. Very glad you could join us on the panel. Would you like to unmute yourself? Le micro
Can't hear.
n'est pas branché. Jean-Claude, le micro. We'll get started while Jean-Claude works on that. So, question for you all. What first drew you to medical herbalism, and then what later drew you to endobogeny?
Hello, everybody.
Hi, Jean-Claude.
Hello, my good English friends, Julian, Colin, Paul Michael. I'm so glad to see you on the screen.
Yeah.
How are you doing? What do you think after such lecture that Kamyar just a few minutes ago gave regarding the evolution of the training I gave you in 20 years ago in England and now?
Yeah.
What do you think, Julian, Colin, and Paul? Please.
Well, it's good to see
Well-
you, Jean-Claude.
Me too.
Are you in the country or in Paris?
I am in the country because I love forests.
Yes. Good.
Well, I know
Well-
that some of you. Go ahead, Colin.
Well, you asked us what made us interested in herbal medicine, basically, and in endobiogeny.
Yeah.
And it was a kind of a thing that evolved for me because I in the 1980s, I was living in Paris, working for UNESCO actually, and I gradually become interested in herbal medicine, and everybody at that particular time in the office got a horrible bronchitis, and they were getting antibiotics and so forth. I decided to go to a naturopathic. He wasn't an endobiologist, but he was a doctor who practiced herbal medicine in France, and he gave me this little tiny bottle with just essential oils in, and it cleared up the whole thing in about 2 days. I thought, well, this is really something. So that made me determined to go back to the UK and study herbal medicine. But while I was in Paris, I started reading the books published by Jean-Claude and Dr. Giafor, the KU de phytotherapy, phytotherapy notebooks. You remember those, Jean-Claude? Maybe can't remember. Yeah, and so I trained in herbal medicine in the UK, and at the same time, I was looking into endobiogeny or clinical phytotherapy, as it was called at that time. And then when I got this job teaching herbal medicine at Middlesex University, I spoke with the dean of the school, and he encouraged me to invite Jean-Claude to London. So that's how we started up the whole series of, you remember those, Jean-Claude? Can't hear. We carried out a series of 2.5-day programs in endobiogeny in the early 2000s, and things just went on from there.
So Colin, it's if I understand correctly, it's like you had a parallel track of
Yes.
education between medical herbalism as it was being taught at that time in the UK and
Right.
this approach to the use of medicinal plants that Christian and Jean-Claude were developing and publishing.
Indeed, that's right. And of course,
And
they went together very well because in endobiogeny, you largely use medicinal plants. So,
how did you hold the space in the different approaches to the use of medicinal plants as you were learning and then teaching?
well, I
Not to
think
say
I
that they're
graduated.
so diametrically opposed, but
Yeah,
they're just maybe they're working on some common levels and then some other levels, and I think each has their advantage and disadvantage.
right.
How did you hold that space and integrate
Well,
them?
I think that often herbal medicine can be practiced rather symptomatically. And so this seemed to me a deeper level. So when I was teaching at the university, I kind of integrated endobiogeny into my teaching. So that I was basically, I mean, Paul can testify that, I was teaching endobiogenic medicine within the herbal medicine program.
Yeah.
And luckily nobody is around to tell me not to do this. Yeah. So yes, it just seemed a natural development to introduce that level of depth into the program.
Was it well received by your peers and by your students?
I think it was. Would you not say, Paul, that was well received?
It was well received by most people. I mean, it was well received by people like me who wanted to learn a deeper way of thinking and to understand the mechanism behind the disease process that wasn't really addressed with classical herbal medicine.
Right.
And then you had some people that weren't so interested because they didn't want to move away from the classical, thinking of traditional herbal medicine, shall we say,
Yeah.
and also people that didn't want to put work in to learn more.
Right.
So
We always
that's
have
what I
those.
find
Yeah.
now, with
Yeah.
a lot of the doctors that I deal with in the UK, the ones that use natural medicines in their practice, they're interested in having speakers come to their seminars where you can plug something in. So, for example, if you have someone talking about a probiotic, a research on a specific probiotic in the microbiome, then they can plug that in, right? They can then just go and get that probiotic and use it in their clinic. But when you give a seminar to them on endobiogenic medicine and they realize how much work they have to do to learn the system, then they shy away.
Yes, indeed. Yeah, because it is hard work. Yeah. There's a lot to learn.
Exactly.
But Colin, it seems to me that the problem is linked to the fact that when we starting training with you in your country, we have no books explaining what is the theory of endobiogeny, because
Yes, that's true.
it took us so long time to develop step by step, months after
Yes.
months, years after year, until the time I met Kamyar in USA. And
Yeah.
at that time, he was able to very quickly understand the complexity of endobiology and go very quickly forward.
Right.
And it was
Yes.
it was a very big step in the development of endobiology. But now we have the written material, so it will go faster, I'm sure, I'm convinced.
Indeed. I mean, then previously we had the books in French, but they were in French. So the Cahiers de phytotherapy. Yeah? So,
Okay, but it was at the very beginning. It took almost 40 years to develop this theory.
Yeah.
40 years.
And I think that the use of even the way that an endobiogeny medicinal plants were approached also evolved. Wouldn't you say, Jean-Claude, for you and Christian? Because when you started learning about medicinal plants from Valnet, it was a very empirical and symptomatic approach. And then you guys had to develop a new concept of terrain, and then it changed the way you approach the plants. Can you tell us a little bit about that?
Exactly. When we started, we were trained by Dr. Valnet, who was a surgeon working in the Ministry of Health. And I had the chance to meet him in 1970. You see, it's a very long time. I was looking at that time for a less aggressive therapeutic products to treat my patient, because I was facing the majority of doctors to the side effects, to the recurrence of disease, and so on and so on. And at this time, I met Christian Durafour, and what interested me immediately, he was 1 year less old than me. He said, "Oh, Jean-Claude, you need to work with me because we have to go forward." Because at that time we were starting the usage of medicinal plants in our daily practice. And very often we obtain very good results. And these results, we were convinced that they will continue in that duration. But in reality, very often, many patients were escaping to what we were doing. And the revolutions that Christian introduced to my mind, he said, "Jean-Claude, we have now to work on the notion of terrain. That is to say, we have to go more in depth in the understanding of what is a human being, and not say only at the peripheral level of approaching patients." And at that time, it was in 1980, he started to train in a group of medical doctors I have gathered around him in France, in Paris, to explain what was the clinical approach, because you have not to go directly to the biology. Before going to biology, you need to start by learn semiology. And
No,
not
sorry,
only,
pardon, je vais juste expliquer. So
okay,
in English, biology means biomarker or lab tests, just so you guys know what we're talking about. So Jean-Claude is saying before you order your labs on your patient, you need to understand the semiology and do a proper physical exam. Please continue, Jean-Claude.
so we were clinical medical doctors, classically trained. And very quickly we understood that we needed to better go in depth in trying to better understand what means a symptom. How can we relate a symptom to a specific, particular aspect of the biology of the person we are treating in front of us? So it is very a specific approach. It's not a standardized approach. We know the classical approach because we were trained in the best hospital in Paris, in resuscitation and so on. We knew that at that time, and we are always in the core of modern medicine. We are not outside. But this approach took a very long time in order to progressively, through clinical patients, to start to understand what are the effects of, for example, an excess of parasympathetic or lack of alpha and so on through patients. And it took a lot of time for each of us. We were a group of commonly 20 medical doctors working around Durafo in our office. He was asking us, what do you think of the patient you have in front of you? And we were discussing regarding the activity of paras, the activity of exocrine, pancreas endocrine, trying to understand how the patient we had in front of you was expressing its own imbalance of the endocrine system, of the an excess of paras. And it took a very long time. It's why when I started in London with Kamyar, with Colin and with Julien, I had not so perfect materials that now Kamyar is bringing to you. It's very fantastic. It's a colossal step forward now. So the first step, we have to look at the patient and to start to understand what means the fact that he is speaking loudly or not, or that he is crying or not, and so on, because that expresses a particular aspect of its own physiology. It's always specific, the physiology. And the physiology is integrated in the human race. The physiology is different in animals. So we are not animals. It is why when we are conducting experiments in order to evaluate the effects of synthetic products on animals, it can be linked, it can make appear, when we apply to human physiology, very different effects that we obtain on the animal or on the cellular experiments.
Jean-Claude, I'm going to take a moment just to summarize for everyone that
Okay.
yeah, based on what Jean-Claude is saying, yeah.
I don't
Jean-Claude brought up a great point.
I don't practice regularly.
I just want to thank Jean-Claude for setting a context for us that this upcoming course of endobiogeny is really different than all the prior courses because it's much more synthetic. You get the information you need for a complex system presented in a very organized way. And you have a team of dedicated instructors who are going to help you master this material. You have the self-assessment tests. You have hundreds of illustrations in color that are presented in the books. You have animations of these static images in the course that'll help you visualize and understand what's going on. And we have the practicum, the experiential lab, where you can now shorten the time it takes you to understand how to personalize a prescription of medicinal plants for your patient based on this combination of your clinical understanding, your physical examination, and what the GEMMA modeling system is indicating as a type of final verification of what's going on in the body at that moment in time. So there's never been an easier time to come into and understand endobiogeny and to start incorporating it into your practice the very next day after every single module. You don't have to struggle in a wilderness of several years of hashing out theory to bring it into your practice. every Monday after our weekend of teaching, you're going to say, I can start to do something. I'm going to order this test on my patient and help them get better. Let's get to Julian, because Julian's also been involved in endobotany for a long time. Tell us a little bit, Julian, about your path into medical herbalism and then how you learned about endobotany, what appealed to you about it.
Well, my path into herbal medicine, it's a very long story, which I have written, and I won't go into here. But I've been teaching herbal medicine, practicing for some years when I met Colin. And in that time, I was aware that what I was doing was incomplete and very unsatisfactory. There was a muddle of archaic models with symptomatic approaches, with empirical approaches. The trouble is with an empirical approach is that when it doesn't work, what do? You've got nowhere to go. And I was in Paris in the early 80s, and I came across, as indeed Colin did, Les Cahiers, the 5-volume, in fact 4 were written, I think, which I still have. In fact, they're on the shelf behind me, of Durafour and Jean-Claude Lapraz and others. And I didn't know what the hell what they were talking about, but I knew they were on to something. And I just pursued it. I went back to Paris and I read around the subject. And then, fortunately, Colin invited Jean-Claude Lapraz to London, and from, there's no going back. And it immediately changed my practice, because it's not really a question of whether the model is true or not, in inverted commas, but how clinically accurate and applicable it is, and how flexible and yet also precise. So precise and flexible at the same time. And that allowed me, it just changed. I mean, I didn't have patients whose treatment failed, put it that way. That sounds a bit grandiose, perhaps, but it meant that I didn't have to see patients for so long. They just got better and went away, and more came, and they got better and went away, and so went on. And so it continues to this day. And I'm still learning. I've made various syntheses of endobiogenics with my own approaches and so on, and have published a great deal. But I'm still learning, and it's a wonderful process.
Thank you, Julian. Well, truly lovely. Sorry, did you want to say something else?
Well, I could go on forever, you know what I mean, but
I want to give a chance for Carol and then Gemma, the newest generation. Yeah. Okay. So Carol, I remember when we were speaking, I think together in London a few weeks ago, you mentioned Rosalind, but I'm not sure how you came to endobiogeny and how you came to medical herbalism. Can you tell us a little bit about that?
The medical herbalism was a bit of well, it's strange how I got there, because I was actually doing a different degree I had a place to do a degree in health and fitness. I was a health and fitness teacher. I used to teach in schools, and and just one clearing day, I got a letter to say, we've been dear Carol Simons, I'm very sorry, you haven't got a place. And because it was clearing day, I tried to call and you couldn't get through. So I panicked and I called Middlesex University and I said, oh, do you have this course? It was the same one I was doing in fitness and health. And they said, yes, come down, have an interview. They said, we think we can give you a place. So I went down. I was looking at the prospectus and I said, oh, it's not very holistic, when I was reading. And they said, well, if it's holistic you want, why don't you do herbal medicine? And I said, what's herbal medicine? And they said, well, the tutor's over there, Andrew Chevalier. They said, go and speak to him. So I went over, I looked at the prospectus, talking to him. Well, I was looking at the prospectus while I was waiting for him. And I was just, oh, this is just what I want to do. And he said, I spoke to him and then said, write me an essay, Herbal Medicine Why, 2,000 words, and I need it tomorrow. And so I went home, went to the library, wrote this essay, and I got offered a place. And then took it, and then the weirdest thing was I got a letter from the other university, University of East London, saying, Oh, dear Carol Simons, we're so sorry. The computer sent you a letter saying you didn't have a place. It was meant for another Carol Simons. We look forward to seeing you on blah, 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 blah. And then I had to call them because the university sorted it out because they didn't want to let me go because I had a place there, an unconditional place. But the computer by mistake sent me out this letter. So to me, it was all meant to be. And I absolutely loved it. And then I thought it was in 1998, but you said it was 2000. And as soon as Colin started doing the courses with Dr. Lapraz, I started to do those in endobiogeny. And it was just amazing. But as Dr. Lapraz said, we didn't have any literature, we didn't have any handouts, and it was very hard to follow. I found it very hard not having a handout and books to read because I like my books. I've got them all here. They're all very worn. It's my volume. So I love to look things up and write in them. And my other one full of, I use them all the time. So not having anything to look at, I found it really hard. And I did it for a while and then I stopped using endobiogenic medicine. But then I got back into it, and just when you use the endobiogenic model, your patients just get quick, they get better so much quicker. I mean, they still used to get better, but it used to take so much longer, because there's so much you can't see. By doing consultation, you can do so much. And I used to find if I did a prescription before I got their results back, it's because they used to take ages, but they're much quicker now. 3/4 of the prescription might be the same as I would prescribe with doing the endobiogenic assessment, but there was always 1/4 of it to 1/3 of it that I would change and fine tune, and that made such a difference. And now I find doing the panels as well, which is a bit extravagant, but I don't know if I'll continue doing all of them, but I'm just learning them at the moment and using them. And I find, I'm using a lot more of the GEMMA therapy that I hadn't used before. And it makes me look it up and learn about it because it comes up as a recommendation. And when I see it coming up on many panels, I then look it up and I learn more about that particular plant that I may not have used before. For instance, tamarisk, which I hadn't used before.
Yeah.
And I hadn't used beech before either. Just herbs like that, tamarisk galata. And yeah, I just find it amazing. I'm just such a fan. And I always use the example of cortisol and the adrenal panel. So when you see a patient, I have a patient at the moment completely depleted. I would think she had low adrenal function, low cortisol, but when you see it, her cortisol was actually very high. It was 64. And you're not,
for those who don't know, who are unfamiliar, the normal would be up to 7.
Yeah.
So 64 will be like 9 times above normal.
And before, this same patient had it at 200. But I would never have, I might have thought, oh yes, she's got high cortisol because of the stress she was going under. But when I saw her 9 months later, she was in a totally depleted state. And if I hadn't done that test, I wouldn't have known that she still needs to have her cortisol treated. And, the opposite can happen, that someone can have low cortisol and you might think because of all the stress they're under, it's high. And I have seen both scenarios that I wouldn't have been able to pick up just by doing the consultation and the physical exam. And yeah, that's just a really easy one to sort of explain, to most people, that the benefits of doing the test. And also the other thing that I find very beneficial is when you do the full panel is when you see the markers for the growth hormone and the growth scores. Because if that was going up and up and higher and you didn't treat it, it's just that person has got predisposition for negative growth to occur. And so just being able to see that at an early stage, when it first starts, or even sometimes you see it and it's in the thousands, it allows you to, start treating that person and reversing that marker. And there may not have been anything in their history that you would have thought, that might have been something you needed to treat.
Thank you. Let's come to GEMMA as the new generation of medical herbalists and endobogenists. Tell us a little bit about how you came to medical herbalism and then to endobogeny.
Well, I was Carol's patient originally, first of all. So that is how I got into this, due to being quite literally saved by Carol in terms of, my mental health and my wellness. And I remember being in the office and being like, always knowing that I wanted to go into some kind of like healing modality, but I was going to go to a school called College of Naturopathic Medicine, which was like a nutrition and sort of, I mean, most people may know it. And Carol said to me, no, I really think you should do medical herbalism as a degree. You need to do a degree. And luckily, Westminster still had the herbal medicine degree. And I was actually the last year to do herbal medicine. They got rid of the degree. So I felt like there was a lot of like serendipity around that, considering that it was, this last year I would ever have been able to do it. And I got onto the course, which I was quite surprised about. And actually, Colin was also my teacher at Westminster, who also introduced me to endobiogenics. But unfortunately, I feel that possibly because it was the last year of herbal medicine and there was a lot of very stressed people, I don't feel that many of the other students sort of invited endobiogenics in as much. So we didn't carry on with it to, finish the modules, which was a shame. But I was very intrigued by it. And also I'd been working with Carol. Well, I'd been Carol's patient, and then I sat in as essentially her protege for many years. So I knew how endobiogenics worked, and I knew that it far surpassed any clinical normal medical herbalism that I was studying at Westminster, even though, of course, my degree was fantastic and I loved it, and what an amazing opportunity that I had. But I always knew that endobiogenics was the way that I was going to practice as a medical herbalist. So then my final year at Westminster, Paul and Colin and Anna put on a course of endobiogenics, which I did coincide the last year, which was actually quite challenging, having my last year of my degree and doing an endobiogenics course simultaneously. But I passed both of them and it was fab. And then really since coming into clinical practice on my own, I've been fortunate enough that I still work with Carol, and we work and share many patients, and most days we discuss, clinical cases. I also dispense for her as well. I go, to her dispensary and I go through reports with her. So I'm constantly being, teaching, being taught, submersing myself, around endobiogenics. And I don't know any other way that I would practice. I don't know how any other way that I would work with clients, to be honest. And even when I explain the GEMMA report to them, or I discuss what I do and how I prescribe herbal medicine, I just see that they're so intrigued and they're so inspired and they're so excited by what I can do, because it's just like such a special element of like understanding a bespoke, unique prescription for an individual's terrain, nervous system, endocrine system. So I feel I feel so blessed, honestly, and so privileged and honored that all of you, the people on this, panel today, that have put in years and years of work to bring this to the point where it is now, where there is so much content, so much understanding now, the GEMMA, that we can deliver this and other people can, start practicing it the way that I do and everybody else does, because endobiogenics does change your practice. It's an incredible, special way of like seeing the individual, the bespoke individual. And I'm really wouldn't have it any other way. I would never prescribe herbs in any other way.
Thank you. Lovely. Before we go on to another question posed to the panel, there was a question in the chat about if the physical exam findings, semiology, is in the GEMMA system. It is not in the GEMMA system, but in each of the well, in the second, third, and fourth volumes of our 4-volume book series called The Theory of Endobiogeny, there are associations between history and physical exam findings, history and indexes, and examination and indexes. So especially in the 4th volume, which is the bedside handbook in English, and that volume, Jean-Claude,
Oui,
le 4e volume en anglais, c'est le premier en français ou c'est le deuxième?
c'est le deuxième.
If you're a francophone, if French is a language you're more comfortable in, the 2nd volume of the French translation is the bedside handbook. That handbook has over 20 or 25 different commonly occurring conditions, including some that are not taught in the 2nd and 3rd volume. And it very succinctly summarizes for all of the key history and physical exam findings, the indexes, which if there is an index that correlates to it, it's presented there for your reference. There's also some questions about the GEMMA system. Maybe we can just take a moment to show, well, we'll save that for another time because we have some videos. If anyone is interested in learning more about GEMMA, Brigitte, when she sends out a link to this video, will also send you a link to some videos about how GEMMA works, and you can learn more about it there. Well, I think all of you have addressed how endobogeny has changed your or enhanced your appreciation and understanding of medicinal plants and how it's impacted your selection of medicinal plants. Is there anyone who wants to say something about that? How it's enhanced your selection of plants? Otherwise, I wanted to, oh, go ahead, Julian.
I just want to say, of course, I've got a particular, I only use plants that I've seen in the wild or have grown myself. Now, that may not be available to everyone, but I think it's an ambition that getting closer to plants is good, whoever you are, whatever kind of physician you are, because you get some primary knowledge there that you can't really get from books. And so becoming a plant person is, I think, an added, it's not an extra work, it's just a joy that really confirms everything you learn.
Thank you. Yes, I should say that it may come across at times that our approach to medicinal plants is quite utilitarian, but it really isn't. At the deeper philosophical level, I would say, I'll just speak for myself as an endobotanist. To me, there's a human-plant alliance, and understanding the way ultimately the umbrella that I use that encapsulates the rational, the biochemical, the symptomatic actions of plants is to understand the personality of the plant, or perhaps more of the signature of the plant, and understand from the totality of all its actions who this plant is, not just what it is, but who it is. Just like we wouldn't judge a human being or a fellow human being by a single action or single aspect of their role, because to call me a father is not incorrect, but it's not complete because I'm more than just the father to my children. I'm other things and I do other things. When you start to understand the plant, not just in the totem of its active constituents, but in the totem of all of its directions of action, where it grows, when it's harvested, what it looks like, what is the traditional names that the local people have used historically for the plant. So like really a type of ethnopharmacological, ethnobotanical perspective, as well as an anthropological and all the others. This is how I like to approach a medicinal plant. And then you have a series of plants which go into a formula or a recipe. And it's like inviting the person to a soiree, to a dinner party with all these characters that are the plants. And you want to make sure that the totality of all the plants that are in a single bottle for a single type of endobiogenic directionality or vector of action are going to be agreeing with the individual. So here's what I mean by this. When I'm working with a patient who I find is psychorigid, as the French would say. Psychorigid is somebody who's maybe a little bit nervous, has an allergic personality, doesn't like changes, is very sensitive. I think actually about using dry extracts, encapsulated plants first, because they're not as dynamic as the extracts in a mother tincture or fluid extract. And to me, gemmotherapy using the embryonic material preserved in glycerin, even though it's like a 1 to 200 concentration, it has much more dynamism and you're using it at a lower dose. So there's a type of person that I would use that with as opposed to a mother tincture or a fluid extract or a dry extract. So all these considerations can start to come into the art of endobiogeny. But the science of endobiogeny is still firmly rooted in this rational association between history, physical examination or semiology, and the biomarker results and the analysis through the GEMMA system. So this is how it's changed me as a person, because I had a very symptomatic and utilitarian approach. I grew up in a family of medical professionals, but with a deep sort of folk knowledge of how to use plants. And actually, I found Andrew Chevalier's book. Carol had said she studied with him. He wrote a book for Doris Kindredly, which was just for the general public, with very, rich in photographs. And that piqued my interest. And even though there was no way I could apply that knowledge, it wasn't specific enough, it was like a cartographic, something cartographic, and it kept leading me to other things until I finally came to meeting Jean-Claude. And that completely changed my life. And it changed how I viewed life, endobiogeny. And it changed how I view life into a partnership between us and medicinal plants. Because whether we're relying on them for food or as food for the animals that we eat or for medicinal reasons, we need medicinal plants a lot more than they need us. And to have that sense of humility in this relationship is really ultimately about creating this larger sense of community beyond just humans using other things to treat humans. Well, that's how endobiogeny changed my life. So I'd like to ask this question as we wrap up for today, of how endobiogeny has changed each of your understanding of life and your approach to yourself and your clinical care.
Who are you asking?
Anyone and all.
Well, I would say it confirmed an approach that I've had all my life without realizing it. I think it uncovers what has been concealed. It's not a new experience. It's an illumination.
When may I speak, Kamyar?
The
use of medicinal plants is much more complex than you can at this step imagine yet. When you are facing a patient presenting an inflammation, whatever be this kind of inflammation, if you stay symptomatic, you choose from medicinal plant known as being anti-inflammatory. But when you look at endobiogeny, you have to try to what particular aspect of physiological imbalance is expressing all of the body of the particular person you have in front of you will make appear an inflammation. And if you look at the data that GEMMA gives you, you immediately understand for which reason in one case you will give calendula, and in another case for the same inflammation, another plant blocking, for example, the excess of insulin reactivity. So it's the clinical approach, the clinical symptom has to be understood related to physiology. And it is the same for the choice of the symptoms related to plants. You cannot dissociate the specificity of the endobiogenic state of the patient and the endobiogenic specific activity of the plants, which will give the better effect in the particular patient you are facing, presenting an inflammation. Two patients presenting the same rheumatoid inflammation will not necessarily have the same anti-inflammatory plants, because we have to understand all the relations in the integration of all symptoms and all mechanism and all the effects of plants. It's complex, but I ensure you, I am 83 years old now, that the success you will obtain for your patient, they will say, they say me, oh, Dr. Jean-Claude, I am glad to know you. I hope that your patient one day, all of you will say, I am glad to have known you and to be treated by you. So keep courage. It's a long way to go to Tipperary.
Thank you, Jean-Claude.
Merci.
Anyone else want to talk about how endobiogenies changed their view of life or their lives?
Evidently. From the bottom to the top.
Well, are there any other questions from the audience, from the other participants, while our panelists are gathering their final thoughts?
Yes, I am. Oh, sorry, did I interrupt anybody? I just not questions, but just some acknowledgements. And Maria Florentina Nenciu from Romania, she loved when Dr. Lapraz mentioned a magic word phrase when he said, "I want to treat my patients with something less aggressive." And she says, "It seems to me that this is so actual and true in these days." So, and she says, "I subscribe to this."
Thank you.
So maybe there is something you guys can tell more about. I was thinking how for some a lot of people, medical doctors are joining our course who might not have any experience with herbs, and they only were trained and have experience with the pharmaceuticals. And maybe there is some guidance you can provide about those medical doctors who don't have that experience, and how their endobiogeny can be still expressed, or how they can include herbs in their practice over time.
Well, maybe I can address that
Yes.
because I came from that position, even though I had some folk experience with medicinal plants, I did not receive any formal training. I never have received any formal training in medicinal plants. But I was so inspired after my first seminar with Dr. Lapraz in the United States. I wanted to start doing something. And so I ordered 3 different types of gemmotherapy. I think it was probably Ribes nigrum, was rosemary, and probably birch or something else. And I just started using these plants whenever it was appropriate, either individually or in combination. Then I ordered a few more, and the next thing I know, I had 50 different plant extracts in my pharmacy. And we started ordering bulk herbs and blending those up in a custom way. And it just grew in a very organic fashion. I mean, in the United States, there are no compounding pharmacies that compound medicinal plants anymore, not on a personal or at a regional level. So we have to do this in the United States, or if you want to offer this to your patients. But in countries where physicians are not allowed to sell supplements, you can start to study the plants. And for example, for our friends in Romania, you have a very good chemotherapy producer in your country, and they sell individual and combination products. So I would recommend you actually start with their combination products and start to treat symptomatically. So you're really repeating the evolution of endobiogeny from Jean-Claude's time until now. You start with a combination, you see the symptomatic effects, and then you can start to recommend different combinations of individual plants if you wish. And then you can start to recommend plants based on their root cause actions over time. And you'll just be amazed with what you can do with even a few plants. We have let's see, something from a medical resident. Oh, great. Rebecca,
Mm.
I hope you can join us actually second year of residency. That's challenging. If you can join us, that would be great. By the way, I forgot to mention.
Rebecca has joined the fellowship.
Oh, lovely. Then that's a big commitment. Thank you, Rebecca. Just like our friend Gemma did in taking her endobogeny course while she was in her university training. I forgot to mention, but when you sign up for the Science of Endobogeny course, all the didactic and the experiential modules are recorded. And if you cannot make an event because you have some other obligation, you can always go back and watch it. You won't be missing that particular module. So there's a lot of ways that you can learn. You could only read all the books and take the self-assessment tests. You could come to some of the lectures. You could watch the videos. You could do all of them and rewatch the videos. It's flexible, and it's here for you to learn within the context of whatever you're currently doing.
Great.
Are there any last?
I would
Go
like to
ahead.
point that there was also an observation in the past expressed by one of the doctors who says, I used herbs empirically for symptoms and in traditional way. And I know you guys discussed about how endobiogeny helps to look deeper, but I would like maybe emphasize that, and our Colin or Julian can say how you guys can really endobiogeny, how it can give total deeper perspective on plants rather than traditional way, which is probably nothing wrong with that, but just what your thoughts would be to emphasize this, how different is endobiogenic herbal medicine versus traditional way, symptomatic.
Well, yeah, well, of course you can use plants symptomatically. I don't think symptomatic should be a dirty word, really, because sometimes the symptomatic treatment of things is appropriate. But that's where you have these different levels, I think, in endobiogeny. You've got symptomatic autonomic nerve drainage, then autonomic nervous system, and then the hormonal level. And often you can get good results with certain people by just doing something at using symptomatic and adjusting the autonomic nervous system. But I think it depends how deep how profound the imbalance is, because with some people you need to go fully into the endocrine area in order to get changes. So I think that's the thing with endobiogeny, with often with a more symptomatic approach, you can only get a certain level of results, but with endobiogeny, they're much deeper, and it gets much more profound results.
Very well said, Colin. I want to just share something that my students always hear me say, which is when you're new to endobiogeny, you're approaching the patient. If you don't know what to do, drain an organ. If you don't know which organ to drain the liver, and you're going to get good results. And similarly, if you don't know what to do, regulate the autonomic nervous system. And I think another way of what Colin is saying is it's the fact that many of the plants that you've been using symptomatically or empirically already have these root cause actions on the critical terrain, which is the pathophysiologic terrain, or the pre-critical terrain, which is the latent imbalance before disease occurs. So actually, sometimes it's not about changing the plants you use, it's about changing your mindset about why you're choosing it and how to better understand why it was effective, either as an individual plant or in combination with others.
Yes, I think Colin put it very well. Symptomatic shouldn't be a dirty word. But someone's got a cough, you give a cough medicine, perhaps. It's perfectly reasonable thing to do. But as you've said, Kamyar, when you give the cough medicine for the cough, it's actually operating at different levels, whether you know that or not.
Yeah.
So it's enormously generous. Medicinal plants are enormously generous and giving in the breadth of their effects. It's quite good to come to understand what they're doing, but you could sometimes you have good luck when you use them not knowing really what you're doing.
I'd like to paraphrase something my professor of pediatric infectious disease said, because he was constantly being consulted like on which antibiotics to prescribe for a virus, or the patient was, he was very frustrated because the physicians were either they were using the wrong antibiotic class for the organism, or they were using an antibiotic for something which is not bacterial in origin. And I was only like maybe 1 month into my pediatric residency, and he turned to me and he said, Kamyar, most patients get better despite what the physician prescribed, not because of it. And but I'd
Very
like to
good.
be a little bit more generous and in an endobiogenic sense that, your prescriptions worked so well despite what you thought it was going to do. Because the plants have their own intelligence and we don't have to know how they work endobiogenically for them to work endobiogenically. They already know what they're capable of doing. We're the ones who are ignorant of what they can do. And the approach of endobiogeny is to help understand the endobiogenic vectors of action and to realize, for example, with a cough, with a deep bronchitis, that when you choose something like elecampane, Inula helenium, it's not just acting symptomatically in this empirical way on the lungs. It's acting as an anti-allergic. It's acting to regulate the pituitary response, to the adaptation response, to the infection, which has irritated the bronchus, et cetera, et cetera. So your prescription is going to work well sometimes despite why you use it, not because of why you used it in your mind. But that's okay because the plants are, as Julian said, generous, and they work with us and they work for us.
And I would like to bring Sergei's question about, because I think it's relevant with about plants and the action. How we being this deep action on the hormonal and autonomic nerve system discovered? How was this deep action discovered? So, because it has empirical observation or for some other, and also Jean-Claude Lapraz had experience learning about plants and endobiogeny, connecting them together. So maybe there is some. You guys can comment on this, how it was discovered, this deep action.
I think that question is for Jean-Claude.
You have to distinguish a symptomatic action when you are facing an acute inflammation from a chronic inflammation, which require much more understanding on which reason is able to explain that this inflammation is permanently instilled. Even though you use anti-inflammatory plants in a great number of cases, you see that you are unable to make disappear the inflammation. But when using GEMMA, it allows you to understand that you are making mistakes using 2 or 3 plants very well known for their global anti-inflammatory effects, because the particular case you have in front of you needs not specifically an anti-inflammatory plant, but plants which are able to correct the hormonal and neuroendocrine imbalance, which is responsible of the specific inflammation that the patient in front of you present. It's a very specific notion of specificity. So we don't reject the specific plant anti-inflammatory, but very quickly when we will use GEMMA on the ratio that Kamyar established, you will understand, oh, I use this plant, but it's not so well adapted to this person because I have to choose a plant which will decrease the alpha sympathetic system and sustain the exocrine pancreas. And it's not necessarily a plant known as anti-inflammatory, because in this case, you adapt the plants to the specific neuroendocrine imbalance, which explains the permanence or the recurrence of the disease. It's why patients, when you are using permanently symptomatic approach, which is useful, we don't reject that, it is very useful. But when you are facing chronic and very severe patient presenting evolutive cancer, even if you say, oh, there is a big inflammation in this cancer patient, his breast is very congested and so on, I will use anti-inflammatory plant, you will have no result because the root cause is not what you can guess. You have not guessed, identified the true cause. It's why we needed with Durafour to give more and more in depth. And it took, as I said, years and years to have more and more understand. But Kamyar very quickly understood that. And he expanded the knowledge in a huge level. Merci, Kamyar. Thank you, Kamyar.
Merci, Jean-Claude. Merci à toi. Well, let me answer Sergei's question, maybe summarizing many conversations I've had with Jean-Claude from the beginning. And maybe it's something that Julian and Colin also know, but Jean-Claude said to me that even in medical school, the late Dr. Christian Durafour, who conceived of the theory of endobogeny, began to have this vision of understanding how the endocrine system and the nervous system are working and associating them with various signs and symptoms. So if you take, for example, the hypothalamic thyrotropic hormone, TRH, well, we know from physiologic research, this isn't just an endobiogenic theory. This is medical fact. TRH is both a hormone, which stimulates TSH excretion from the pituitary, but inside the brain, it's a neuromodulator. It accelerates the rate of synaptic transmission of other neurons throughout the brain, and it has a direct synapsing action on the limbic area and the hippocampus. So we start to understand that TRH has a central nervous system activity related to anxiety, to traumatic rumination, to insomnia, to the vividness of dreams, completely independent of its classical vertical stimulation of TSH and the promoting the conversion of T4 to T3. which is its purely endocrine action and endocrine metabolic action. So you can imagine that Dr. Durfour, when he had a patient who had these various signs of elevated TRH, for example, maybe they were fluttering their eyelids a lot on glabellar tap, or they had anxiety, or they had very vivid dreams. And then he prescribed motherwort, Leonoris cardiaca, which traditionally is understood to be a sympatholytic and to have actions on the heart and regulating arrhythmias, which is also related to TRH, or can be in some instances. And then you see that all these signs and symptoms related to excessive TRH become abated. You can start to make this empirical association that motherwort has a direct action on TRH, and by its actions on TRH is able to affect all these other symptoms, which are dependent in part or whole on TRH. And in that way, from what I understood in my conversations with Jean-Claude over the years, this endobiogenic vision of how plants act, for example, lithospermum, stone seed, or other similar plants where we talk about these really endocrine activities at the pituitary level, at the peripheral level, the hypothalamic level, started to become associated, because each of these hormones, be they hypothalamic or pituitary trophin or the end organ hormones, have known signs and symptoms. And when you use the plants and you see them addressing the problems in these specific models of disease, you start to understand that these plants are actually working at this higher endobiogenic level of addressing the true root cause of the disorder. Gemma, you're muted if you wanted to say something.
No, I was saying, yeah, the TRH is definitely something that I see in many patients that are raised.
Yeah. Yeah. Jean-Claude, did I summarize that accurately?
Yes, yes, yes. It's a good summary. Yes, very good.
Okay.
I hope that endobiogeny is successful in my practice, and I'm hoping that it will be the same in your own practice to all of you who are participating to this seminar. Thank you beaucoup.
Merci. Brigida, were there any other questions? I think there was a question from Romania for a francophone. 3 of the 4 volumes of the English textbook series have been translated and published in French. The 4th one has been translated and is awaiting publication. Is that correct, Jean-Claude?
Yes.
When will the 4th one be published?
It will be published in September
Of this year.
this year.
Very good. And again, the first volume is the volume on the science of endobiogeny that we will be teaching from. It is not required that you purchase the 2nd and 3rd volume, which are deep into. So the 2nd volume in English is less complex clinical disorders, and volume 3 is more complex clinical disorders. And volume 4 is a bedside handbook. If you were going to purchase an additional volume right now, I would recommend you get the 4th volume in English, which is the bedside handbook. And in French, it would be the 2nd volume, because that summarizes the first 1,000 pages of volumes 1 to 3 in about 100 pages or 150 pages. And if you ever want a quick summary of what you read in volume 1, you can find it in volume 4. And volume 4 has clinical pearls and clinical tips, which quickly show you how the theory is expressed with real case studies and in clinical practice, which you don't find in the first 3 volumes. Also, volume 4 gathers all the major endobiogenic diets that are talked about in volumes 1, 2, and 3, if you want to start recommending those for your patients. And once you get the understanding of the science of endobiogeny, even before hopefully you've taken the clinical endobiogeny course, which will start in 2026, you can start using the bedside handbook to give you some really good guidance on treating over 20 different common disorders. Well, let's conclude. Brigitte, do you think you could bring up the page with the registration and share that just so everyone sees what it looks like? So while Brigitte is doing that, we'll just conclude that by reminding you that the Science of Endobiogeny course begins in June of this year. We look forward to seeing you there and growing our community of endobiogenists all around the world. If you want to sign up, you can go to this page here, and Brigitte will share that link with you. She shared it in the chat box. You can click that now before we close for today. And you can see our early bird special that remains. You can, there's $100 off, and you have the option of a split payment if you wish, and get signed up. And also you can start your 6-month subscription early if you sign up by April 15th. And our instructors will be myself and Dr. Adam Johnson. And you can watch some videos talking about the power of endobiogeny and its impact at the bottom of the page.